I woke up during surgery to remove a bone spur from my big toe. I must have made a sound because the doctor looked at me and said, "What are you doing up? Go back to sleep." I said, "Do I have pretty bones?" And he said, "Yes, now go to sleep." And then I went back to sleep. I did not feel any pain at all and I was so drugged up I wasn't even scared. I woke up during a routine colonoscopy. It felt like they were shoving a board through my intestines. The pressure was unreal. I remember I was finally able to say, "Please stop." Both the nurse and the doctor's eyes got as big as saucers, and that's the last thing I remember. Normally, you wake up in recovery, get up and go home pretty much alert. I slept for 24 hours because of the extra bump they had to give me to put me back under to complete the colonoscopy. I woke up in the middle of a root canal. I remember opening my eyes and not knowing what the hell was happening. I grabbed the dentist's hand, and doing so, I scared the life out of him, he ending up screaming and yelling for the nurse to increase whatever cocktail for I had. After he was done and I was fully awake, we laughed about it and he told me I was his first patient to wake up in the 15 years he's been practicing. I had a C-section without a drop of pain medication or anesthesia while I was conscious. Awake from the first cut until my daughter was clear of my body, then I was intubated. I don't know if that counts. Since there was no sheet or anything covering me, I was weirded out at first. Being naked like that was the least of my problems though. There was a lot of screaming, coming from me and others, but I don't know who else besides the surgeon. The worst part was feeling my blood rush up inside my abdomen and pour out over my sides. I can't describe it, it was hot, and the sound it made when it hit the floor still haunts me 2 years later. It was gnarly. I was forced to wake up in the middle of 2 different surgeries. First time they found one of my 4 wisdom teeth in my temple, they already got another one out at the time. They had to wake me up and take me to their brand new 3D CAT scan machine, never used before, to find that tooth in my temple. My surgeon never saw this happen in his 15 to 20 years of practice. Supposedly I tried to keep the wisdom tooth that they took out prior to waking me up, and I tried to fight off several nurses before getting to the machine. Second time I had to get a scarred snap tendon out of my hand. Halfway through surgery they had to wake me up for me to do a fist, so they would know if they got all of it. They woke me up and I looked at my hand filleted wide open, made a full fist. Everyone in the room made a quick celebration and then they knocked me back out for the remainder of the surgery. I was getting an ablation done to my heart because of an irregular heartbeat. I woke up at apparently entirely the wrong moment because I moved a bit, and the doctor started screaming, "Sir, do not move, this is a critical part of the procedure." Something like that anyway. A nurse appeared next to me and literally held my shoulders down until they put me under again. Was a scary 30 seconds or so. I was 14, getting my elbow replaced. I woke up and started choking on the airway tube down my throat. All of the people in the OR just kept saying, it's okay, we're finished." Then they took the tube out and I knocked back out. When I was in recovery, the surgeon told me I woke up halfway through. They told me my surgery was finished so I wouldn't freak out any more than I already did. The man asked if I'd felt anything. I just told him I felt my throat was extremely dry and I didn't like all of those people hovering over me. He was relieved to know that I didn't feel the half of the bones in my arm were gone. It was a 15-hour surgery because the part they had didn't fit, and they had to get a new part flown in while I was under. I woke up while everyone was just kind of sitting around, making sure I was still under. It wasn't as physical and comfortable as it was panic-inducing. You're out completely, then you wake up thinking you've been abducted by aliens. I woke up for a couple minutes during my surgery to remove my gallbladder. I couldn't move at all or open my eyes much, so all I could see were the doctor's silhouettes and the bright light. I could hear everything they were saying and I still remember it. I was panicking about being awake even though I didn't feel any pain at all, but I was desperate to let them know I could hear them and that I was awake. But I guess I fell asleep again right after that because I don't remember anything else. I mentioned it to my doctor after and he said that happens sometimes. It was terrible. I was getting all 4 wisdom teeth removed. Apparently the roots were so deep and close to a nerve I didn't have an option not to be put to sleep. When I woke, I didn't remember what was going on or why. All I knew was there's something holding my mouth open, tongue down and what felt like 4 hands in my mouth. Once I moved, people held me down and they continued. In that moment, I felt like being tortured. I was having surgery to repair a pneumothorax, collapsed lung. I vividly remember waking up in the middle of it, and looking up at the doctor. I looked him right in the eyes, Lifted my left arm, they were working on the right side, and tapped the face mask. He nodded and I was out again. I've actually had a few similar instances. I've got the ginger gene that makes drugs and anesthesia and such less effective. Problem is, unless I have facial hair you'd never notice I was ginger. My beard is bright red, but my hair is blonde. I have to warn doctors and dentists that they might want to up the requirements because it doesn't work very well. I wasn't put under for my wisdom teeth extraction, just given halcyon to make me loopy, and out of it, I wasn't supposed to remember most of it, and of course local anesthesia. But halfway through the procedure I vaguely remember beginning to cry as I felt the dentist struggle to get part of a tooth out, and it literally felt like he was just trying to rip the thing out of my head. Horribly painful and traumatic. He was like, "Oh gosh, you gotta tell me if it hurts." Well, I tried, sir, but I'm more drugged than I've ever been in my life and your hands are in my mouth. So I was having a splenetic embolization. Basically my spleen ruptured and they fed titanium wire through a vein in my groin to stop the bleeding. They didn't put me fully under but just sedated me. I woke up twice. First time they were shaving the area. I told the nurse, in a very drugged up state, "It's getting pretty bushly down there. Do you mind finishing up the rest?" She laughed, then gave me more meds. I passed out again. Later I woke up again, lifted my head up and asked the doctor, "How's it going down there?" He looked at me and says, "Pretty good actually." He then looked at the nurse very seriously and says, "Sedate him now." I then passed back out for the rest of the procedure. They had the area numbed for the procedure so I felt no pain when I woke up. I thought the whole thing was pretty funny and joked with my nurse after about it. I woke up to pain not during surgery but in the recovery room. I came to and started screaming. I must have still been high from the meds because when the nurses rushed over their faces had no skin and then the walls started melting. They tried to calm me down but I just kept screaming and demanding my husband. I remember freaking out, and the scary hallucinations, and my god the pain, but not what I said. When I came back to myself I had tears on my cheeks and my husband is holding one hand. Family isn't supposed to be allowed in recovery, and a nurse is holding the other and I'm still in incredible pain. I was the last surgery of the day too and they all had to stay back because I wouldn't calm down. I think waking up during would be less dramatic because surely they could just increase the dosage and put you back under? I think I woke up during abdominal surgery. It felt about like you'd think it would feel with someone rooting around in your abdomen. Pain. So much pain. I don't remember the sensation that I couldn't move. It's hard to remember exactly because I felt disoriented and my head was kind of spinning like I was drunk. The worst pain was from where the retractor was, the thing that holds the incision opened. I could feel it mostly on one side, and it just felt like somebody was pulling me apart with it. I also had the worst headache I've ever had, but the abdominal pulling was worse. I've always had suspicion my anesthesiologist was diverting meds or something, because I got better when I could get off IV meds and take pills instead. I woke up during a bone graft on my right wrist. I remember opening one eye to look around. I saw the surgeon working on my wrist, with my forearm opened up, and my skin looked like a curtain. It was maintained on the sides of my arm with little pins. I didn't feel anything and didn't really understand what was happening. It felt like I was watching a movie. I remember trying to say, "What are you doing?" But a nurse immediately realized I was awake, so she told me it's okay and someone put me back to sleep. I've woken up during every procedure I've had. I'm a redhead and I've heard from a variety of sources that redheads are genetically less sensitive to anesthesia. The worst one was a colonoscopy. I was 25 and flabbergasted that I needed one. The preparation is terrible, you're just pooping mucus every 15 minutes toward the end of it. I am terrified at the small risk of puncture, so I cry quietly but uncontrollably as they wheel me into the operating room, much to the chagrin of the clearly uncomfortable male nurse beside me. My doc comes in, sees me crying, and pets my head and comforts me as they administer the anesthesia. Again, propofol. Again, I wake up halfway through with a vague sensation that something is up my butt. I can feel it all the way from my rectum to what feels like my stomach, but I don't care because I'm pretty out of it. I hear my doc confer with the team, saying there's actually a polyp. Prior to the procedure, she told me that I almost assuredly wouldn't have anything since I have no family history of colon issues and because of my age. I think I giggle at the situation, then one of the operating team audibly gasps and whispers, "Oh God, she's waking up," then I go back under when they increase the anesthesia. I wasn't sure it happened, but later after I wake up, I ask my doc if she found a polyp, She looks surprised and says yes. For inquiring minds, the biopsy came back all clear, although I do have to get colonoscopies every 3 years now. I think I woke up during abdominal surgery. I was really out of it, like I felt confused and very drunk, so hard to remember it well. But I woke up in the OR and it was pain. Like about exactly how you'd imagine it feeling if someone were digging through your open abdomen. What I felt most, oddly, was the retractor, the thing they use to pull your incision opened. I could feel the pull hardest on one side and it just felt like someone was pulling me open with that thing. I also had an unbelievably bad headache. Like the worst headache I ever had, but it wasn't as bad as the weird abdominal pain. I didn't wake up during surgery, but I have a similar experience. I found a lump on my chest, which naturally I was worried about. I went to the doctors and was told that it was completely harmless, but they would take it out anyway if I wanted. I said okay, as it was clearly visible, so why not? I go for my pre-op, where I am told I won't be unconscious for the operation, instead I will be having a local anesthetic. I was immediately concerned as I just assumed I would be asleep. Doctors assured me I wouldn't feel a thing, so I agreed. A month later, time for surgery. They roll me into theater, scary place to be while awake, genuinely felt like a horror film, and proceed to inject the local anesthetic into my chest. I had a screen in front of me by this point, so I couldn't see a thing. The doctor begins to cut my chest open. I felt my skin parting, but no pain, a very uncomfortable feeling still. But once he starts attempting to remove the lump, I feel incredibly sharp pains deep in my chest. The realization hit me like a ton of bricks that they had not applied enough anesthetic to completely numb the pain. I didn't really know how to react, so I simply shouted stop, which the doctor did immediately. After this point, it all becomes a blur, as I then suffered a panic attack due to how scared I was. I admit, I was very scared when I felt a lot of pain. They had to give me an adrenaline shot as my heart rate was plummeting. I remember the blur of at least 10 doctors stood around me, which made the situation even worse. After my heart rate returned to normal and I came round a bit, the doctor asked me if I wanted to carry on, to which I literally responded, F that. After going through that, they agreed that it would be a good idea to give me general anesthetic next time and knock me out for the procedure. My surgery date is 11th September. Let's hope I don't wake up during it. I looked down and saw my toes were cut open, but couldn't feel it because they did a local. I had to pee really bad. The nurse told me I had to wait because they were in the middle of surgery. I told her no way. After a bit of arguing they brought me a bedpan. It was hard to pee because I couldn't really sit up. Eventually I was able to. That is all I remember until waking up in the recovery room after. I think they gave me more sedative. I had a cardiac ablation, burning off troublesome electrical tissue, in 2014. The nurse anesthetist told me she doesn't like to use propofol, but rather versed. Me being a paramedic asked what dose she would use, since propofol is more commonly used and I was concerned about waking up. She said oh we'll start with 3 milligrams, which instantly worried me. Versed is weight-based, and I should have been given at least 5 to 7 milligrams. So the procedure starts and I wake up feeling this intense burning sharp pain in the left side of my chest. I remember yelling ow and hearing the physician saying to sedate me better, back to sleep. I wake up again yelling God. That burns when they burned a second time. This time the physician yells get him sedated, now. Oh, you thought that was it? Nah. They put me into V-talk, very fast heart rate, and ended up cardioverting, shocking, my heart. I woke up for that yelling. Well, after numerous complaints and threats, my $61,000 hospital bill suddenly became $0. Oh, and the cunt of a nurse anesthetist. She had the gall to triple bill for anesthesia services because I had to be sedated so many times. I was placed under twilight sedation for my last eye surgery, but for whatever reason it just didn't take. The anesthetist said it does happen, but he'd never met a patient so resistant to the medicine. Yay me. Had a few before and they worked with varying success. This time I was wide awake the whole time. I wasn't in any pain because they'd numbed the area they were working on, and obviously I couldn't see anything. I was paralyzed. I just asked the surgeon to narrate what he was doing, especially with some of the stranger noises and smells I was experiencing. It was actually pretty interesting. Under general anesthetic I've never woken up. I woke up during back surgery. I was having a spinal cord stimulator implanted in order to help me better manage my back pain from 2 previous failed surgeries. I spoke with the anesthesiologist before the procedure and she assured me she'd keep me safe and knocked out. As I was wheeled into the operating room, a new anesthesiologist approached me and said, "We might just do local." I had already been given some sedatives, so I just murmured, "No. Please don't." Unfortunately, I felt everything. I have 2 incisions in my back, one for the battery pack and one for the stimulator leads. I felt them cutting into me. Absolute agony. I cried out in pain. My surgeon yelled at me, "Why are you screaming?" I had a hard time forming words with the oxygen mask over my mouth. I remember saying, "Stop. I feel it. And please knock me out." But the anesthesiologist was in another operating room. It was one of the most traumatic experiences of my life. And unfortunately the spinal cord stimulator doesn't work, and I just have this implant inside of me until I decide to go under the knife again to have it removed. Which may be a while.